children, as the developmental phases go on progressing, it is very common for them to go through their own set of emotional ups and downs. For every emotional ups and downs, we don't need to rush to a mental health professional, ideally. But then we also need to know that when we should. Okay. So there are some sort of red flags, if I might say, which if you notice in your child, I think it is always good to connect with a mental health professional immediately, right? So those red flags are something like, for example, whatever the child is doing, you suddenly see that it's different. So initially he was going happily to the school, he was mixing with his friends, he was himself going out to play. Okay. And you see that all these things have stopped. The child is not wanting to go to school. He no more proactively says that, okay, I want to go out and play. He no more proactively says, and I want to go and attend a birthday party. So if you see any change from the regular behavior of a child, which is persistent even after you have given significant amount of time and significant amount of uh, consolation or pacification to the child, yet the things are not getting under control and the child keeps on avoiding people, not going to school, then it's a time that you should see a mental health professional. Apart from that, if you start hearing in your child's talks, whenever he's sad or angry or fearful, if you start hearing statements like, I wish I wasn't ever here, I don't think I'm good enough, uh, I wish, I wish that I just run away somewhere, or maybe something like, I don't think anybody cares for me. So all these statements, if you see that they are coming much more than often, it's a time that you should see a mental health professional. If you see some behaviors such as self-harming behaviors or behaviors where the child is causing harm to somebody else, so it can be anything, right, from biting, scratching, hair pulling, pricking himself or others, hitting himself or others, uh, all these things are signs that there is some turmoil going on within the child, which is coming out via this aggressive behaviors, and you should seek a mental health professional's help. Similarly, if the child starts being suddenly withdrawn or suddenly too clingy towards caretakers, or you notice that he is using lot of excuses in terms of physical health, he is trying to avoid some situations or trying to avoid going to particular people or trying to avoid to go to school by using excuses such as there is stomach pain or headache, and you're taking to the pediatrician and doctor says that there is nothing wrong with the child. So if this is happening, again a sign that child is going through something which is not able to tell you clearly, so you need to seek help from a professional again. Apart from that, if you feel any kind of talks where the child is expressing worthlessness, hopelessness, feeling of low confidence, feeling of low self-esteem, where he's continuously bringing out a lot of comparisons between him and his siblings or between him and his friends, which are not ending even after you tell him that how good you feel about your child, again a sign that the child might need help. Okay. Apart from that, also observe if the child undergoes any significant change in his sleeping habits, his eating habits, his socialization habits. Okay. Any significant change where the child is eating too much or too less, or he's sleeping too much or too less, or he is suddenly stopped socializing or trying to be continuously out of the house, again, are some signs that the child is going through something and probably he needs to talk to somebody else, probably a mental health professional. Okay. See, another thing that I want to highlight here is that parents feel that mental health issues only happen in adults. Yes, they very commonly happen in adults. We all adults do face through the same issues that I mentioned just now when we go through emotional turmoils, but at the same time, children too are equally vulnerable. Okay. there is a notion कि बच्चों में क्या depression, बच्चों में क्या anxiety, but that's false. Children have definitely their own set of emotional struggles which they cannot manage on their own. And plus, they are highly dependent on the adults around them to identify it correctly, pick it up in the right time, and take them for somebody to help them out with it. Okay, so we need to be careful about these warning signs. At times it is okay, even if you think Arey, I don't think it's a warning sign, but I feel something is wrong. It is okay to go to a mental health professional and find out that there is nothing wrong, right? It is always better to be safe than sorry. Okay, these are the warning signs in children. Even in adults, we have to be careful that the warning signs are of similar nature, where the adults are also going to suffer from changes in the way they are sleeping, they're eating, they're socializing. Whatever they are going through, it can start affecting their family relationships, their work life. Okay, if they're going through anxiety and if it has affected their relationships, and if it is not letting them to work properly, then that anxiety needs to be managed with the help of a mental health professional. Same way, if you see somebody getting suddenly close, not picking up your phone calls, not coming to you, which he or she would often come to you, stop visiting friends. Okay, again, these are the signs that he is not okay or she is not okay. Same way, signs of hopelessness, signs of suicidal ideations. When a person says that, okay, I must clear all your dues. If a person says that I need to make a will. If a person starts saying that I don't know whether we are going to see you on next New Year. All these are signs that we have to be aware of. If a person again becomes too clingy or too socially withdrawn, it's a sign that there is something wrong. If a person is indulging into self-harm tendencies, or as simple as even cutting or trying to cut or trying to burn or harming somebody else, showing some tendencies where he wants to harm somebody else, showing some behaviors which are repetitive in nature, for example, continuously washing hands, continuously praying, continuously touching objects, all these are signs that the adult also needs some kind of professional help. It is better to get assessed well on time again before the problem goes beyond our control. Okay, so be it a child or be it an adult, if you notice any kind of these signs, please approach a mental health professional immediately. Discuss all the concerns. Let the mental health professional take a detailed account of all the problems. Let the mental health professional evaluate properly. And once the evaluation process is complete, your mental health professional is going to figure out a plan of handling this situation. This plan can include a huge set of different kinds of intervention methods. For example, in some cases, we might need medications. In medications too, we have either allopathic medications, what we call it as, or it could be homeopathic, or it could be Ayurvedic, depends on every case. It could be at times only medications. It could be at times medications coupled with some kind of psychotherapy. Again, in psychotherapy, for children, we have play therapy. We have not just for children, actually, for all age groups, we can have a huge number of therapies such as play therapy, art therapy, music therapy, dance movement therapy, cognitive based therapy such as REBT, CBT, DBT. These are huge number of therapies that are available today. But every client will not need all of them. So we have to customize what the client needs. Okay, so that decision will be taken by your mental health professional. What you as a parent, or what you, for the person for whom you're approaching, you can do is definitely have a discussion with your mental health professional as to first, what is the problem? Is there any clinical name for the problem? And what are the treatment methods, or what are the intervention methods that the therapist or the mental health professional sees apt for this particular child or an adult? So ask them, discuss with them, discuss various aspects of why particular therapy or why particular medications, how are they going to help, to what extent are they going to help. Have this discussion in detail. Ask how much can be your role as an individual. For example, when it comes to parents, parents also have a key role to play when the child's therapy starts. So do ask that how much role they have to play when the therapy starts. And after a thorough discussion, including even the discussion of the financial aspects of the treatment plan or the therapy that has been advocated, then take a collaborative decision with the help of your mental health professional and go ahead with the therapies. Last but not the least, whatever outcome of this discussion comes, do see to it that you stick with your mental health professional for a substantial period of time. One of the major misconceptions that we have is that do 3 sessions liya, we have taken 2-3 sessions, we have been taking medications for a month, but there is no result, so why continue? Or I am feeling better, so let me drop off. Please do not make that decision on your own. Again, that decision has to be collaborative. If you don't feel any relief, discuss it with your therapist or your mental health professional. Many times in mental health, what happens is, unlike physical health, tangible results don't come very quickly, because if we are looking at changing the way your neurotransmitters are functioning, we are looking at changing the neural connections that the brain has already formed. So that process is not always tangible. Unlike fever, you take crocin and on thermometer within few hours you can see objectively that the fever has gone down. So the process in mental health is not always tangible, and it cannot be always objectively measured whether it is effective or not. So do not take these decisions of stopping any therapy or starting any therapy on your own. Always make it a collaborative and an informed decision with the help of your mental health care professional.